Do you think life is simpler after you retire? For some, it's actually more complicated when facing issues about health, estate plans, probate, long-term care, and more. That's why Attorney-CPA Joe Cordell hosts Elder Talk, providing smart strategies for seniors and an open forum for older adults with important questions about their future. Here's Attorney-CPA Joe Cordell.
Welcome. This is Joe Cordell to another week of Elder Talk. With me is my co-host, Susan Arthur. How many of you feel that you completely understand, you've got it all figured out, you know the answers to all the questions you've had regarding Medicare?
Not me.
I think I know that the answer to that probably unanimously, Susan, is people are saying, nope, I have lots of questions. And that's kind of the nature of Medicare, is it's a very complicated program. Thankfully, there are organizations in place to answer those questions. And today we have someone who is going to talk about some of the most important things you need to know, those questions you probably have and you didn't know where to turn to get them answered regarding Medicare. Susan, you want to introduce our guest?
I would love to. This is a very timely, important topic for you because the deadline for open enrollment in Medicare is December 7th, and that is coming up. And our guest today is Julia Allen. She is the regional liaison for the St. Louis area of CLAIM. Now, maybe you're not familiar with CLAIM, but CLAIM is a nonprofit organization across the state that offers free, unbiased, confidential assessments and counseling on what is the best Medicare option for each individual. They will even help you fill out the paperwork. Julia is a graduate of the George Warren Brown School of Social Work and has a bachelor's degree in business management. She has over 15 years of nonprofit and aging service experience, including working at CLAIM. She's worked as an AmeriCorps volunteer and an aging specialist with St. Louis Area Agency on Aging. And she has provided information and assistance and advocacy and supportive counseling to help clients just like you access and understand these particular government programs. Welcome, Julia.
Thank you, Susan.
Yes, thank you for taking time to visit with us, because I can tell you that I'm kind of not at that threshold yet. I'm going to turn 60 soon. But, I know that Medicare is this complicated program that I spend a lot of time talking to clients about and still feel like there's things I don't know. And let me also clarify what this organization CLAIM. It's really an acronym, and a great acronym. It stands for Community Leaders Assisting the Insured in Missouri. So that's what CLAIM is. So it's a not-for-profit, as Susan was explaining. So that's what I like about this, is that everybody's selling something in Medicare. I mean, that it's kind of the nature of the program that you have a lot of private participants who, I guess the whole idea is you want them to compete. But they're competing in an environment where their clients are kind of clueless. So it gives them a huge advantage.
And it's hard to know who to trust.
Yeah, exactly. And to the idea that everyone in Missouri has available to them someone in your organization who can answer these questions.
Absolutely.
Go ahead and tell us a little more about how long your organization's been in effect and the areas that you're serving specifically.
Okay. We've been in effect since 1993. We got a grant from the Department of Insurance from the state of Missouri. So we're getting ready to go into our 25th year.
25 years.
25 years. Services are free. We have over 300 volunteers statewide. 300 volunteers statewide, and we have over 180 CLAIM volunteers throughout the state of Missouri.
So if someone has a question about Medicare, let's say that they're getting near the age where they can qualify for that.
Okay.
You would suggest then that they go ahead and start getting answers to these questions before they commit to any particular plan.
Absolutely. And the key to this to me is that ask questions. Do not be afraid to ask questions. You can call our office, even if you're not Medicare eligible, but you're thinking about it. We have a lot of people who maybe call a year ahead of time just to ask questions because, like you said, it can be confusing. And if people are still working, there's that option where even though you're turning 65, you may not necessarily have to sign up for Part B. So it's good to call our office. We have a toll-free 1-800 number where we have the call center screens the calls, and based on the location of the calls, the referrals are sent out to the counselors every day. Usually, the waiting time is no longer than 3 days. If we can't get in touch with you after the third day, then we send the referral back, and they will send them a follow-up letter. So it is a process so that nobody really falls through the cracks.
So do you find, though, that you generally recommend as being the best buy for most people to think about using, for example, Medicare Advantage versus just the standard plan? How do you lean in terms of your advice?
Well, I can't say how I lean.
She could probably get in trouble for that.
I can tell you, we try to give people the information and sit down and put it in front of them so they can see the differences. Because when you do plan comparisons, it's not like, there are differences because they're insurance companies. So they're going to be set up a little bit different. They may have some general things like, say with Advantage plans, a lot of them don't have monthly premiums for the drug or the health. Maybe they may not have a deductible. Then you would have some that have an annual deductible, which for next year it's gone up $5. It's $405. So they can charge you anywhere from $0 to $405 before you start getting the benefit of the plan. Drug companies are the same way. They're all different. And I usually advise people, think about this in terms of long-term and finance. How much insurance do you need? How much can you afford? A lot of people my age, mature adults, as we get older, we have chronic illnesses just pop up all of a sudden. And some people my age, they're healthier. So it would make a big difference whether they're in an Advantage plan or using original Medicare and a Medicare supplement.
So generally speaking, if, for example, they do have these chronic problems and
right.
they do see that they're going to have to have regular care, might that suggest that perhaps something like the Advantage program would be better for such a person?
Not necessarily, because with the Advantage plans, they're co-insurances, okay? And sometimes those are like a hidden cost, okay? Sometimes the Advantage plans may not really discuss the co-insurances very well with their clients. So say you get in an Advantage plan, you don't have the monthly deductible, you don't have a monthly premium for your drug or your health, but every time you go to a doctor, a specialist, you have an upfront cost. So once you pay that upfront or that co-insurance, the next thing is you get a bill. Then you're responsible for that 20%.
So, and you also might give up some independence in terms of what physicians you use. I assume that's a big deal.
It is a big deal, and a lot of people do not even think about that. Usually I tell people when they're looking at Advantage plans, first thing, call your provider. Ask your doctor, your primary care physician, or the specialist you're attending if they take it. Advantage plans tend to be regional, so that means if they're network bound. So if your doctor's not in the network or the hospital's not in the network, the plan may or may not pay for some of that service. So it's always best to call those plans and check with them. A lot of people don't realize that until after they've gotten in the plan, and then they have to go to a specialist, find out the specialist in that doctor's office is not in the network. So they have to go to somebody else. Another thing that I found is that most people have relationships with their primary care doctors already. I've been with my primary care doctor for like 25 years.
And that's not unusual.
I know. Mm-hmm. And it's like, if they're not in that network, that means you're going to have to find a new provider in that network that takes that insurance.
And that's difficult for a lot of people.
Absolutely.
Because then you do feel like you're starting over, because this doctor knows that, okay, I always have an allergy every summer or something like that, and it's just not a normal thing. Whereas a totally new doctor, you feel like you're starting completely over again with all your aches and pains and everything else.
And when you think about what is probably the most economic medical system for taxpayers generally, or for the public, and HMOs, I think there's a lot to be said for them if you're talking about just efficiency. Because, you have these people who are employees of an organization, and they control costs, and you go to these particular people, and then they're incentivized to not be wasteful, and et cetera. So it always made sense to me when HMOs emerged, and I'm old enough to remember that in the 80s. And then they just never quite gained the sort of momentum. I think a lot of people thought when HMOs came along that was just going to sweep the landscape, that, this is it. This is the idea that makes the most sense. And it turned out that, you didn't hear a lot about HMOs a lot after they first emerged. Yeah. And I guess this represents an example, does it not, that the Medicare Advantage option really gains those efficiencies by requiring you to go to specific people.
Yeah, but like I said, you really, if you're thinking about an Advantage plan, I think Advantage plans are geared more towards healthier people. Medicare has started providing preventive care services, even with original Medicare now, so that's cutting down costs. I do know that doctors are provided with incentives to be more efficient in their private practices and things like that. So there are some changes behind the scenes that a lot of people aren't aware of that are going on. And like I said, what we do is we sit down with the client, do the comparison, print it out, so that they can see the dollar amounts.
Now, this is an important point. I don't know that people realize this, and I didn't either. So it's not simply a matter that they can call this phone number and ask a question and get it answered. But it sounds like you will assemble the information they give you. You must have a spreadsheet or something that can
Medicare.gov. That's the spreadsheet. Everybody uses Medicare.gov now, but that's our primary contact. So we get certain information you can get from them. You can either do a general research or a general search or if you don't have all of their Medicare information, you can do it by zip code, as long as they know what health plan or drug plan they're in.
So then the questions that come up in people's mind if they try to fill out such a form, they can actually, without charge and without bias, let me emphasize that to people listening, there's no kickback or there's no relationship with any particular insurer, et cetera.
No.
So they can call you, they can let you answer those questions as they fill in each of those fields as to what that means.
Or we can get their information, fill it in for them, then mail them the comparison. What I usually do, if they ask me for a comparison, I'll tell them, I'll take the information they want to give me, because one of the things we ask for is the Medicare number. And people don't like to give that number out. We tell them, do not give out your Social Security number, do not give out your Medicare number. So even if we don't have that, we still have the other route. So once we do the comparison, we know what plan they're in. We have their drug list, because you have to have the drug list to get a more accurate feel. Then we can print that out for them and then mail it to them. Once they get it, they can call us at any time with any questions they have. The other alternative is that, like I said, we have partners throughout the community. We can meet them. I meet a lot of people at the public library. I can meet them, like we partner with the Maryland Heights Community Rec Center. We partner with the Mideast Area Agency on Aging, the St. Louis Area Agency on Aging. So usually wherever they want to meet, especially if they call me, I try to make myself available, and I will go meet with them and talk to them and try and answer any of their questions. So we do one-on-one.
I'm convinced that this is not very well known.
Oh, I don't think so.
It's not.
Yeah.
Too many people make bad decisions in terms of what they're signing up for.
And you talk to an insurance agent. That's probably what I would do. I would call an agent and go, okay, I need to do, not even knowing that this is here.
Yeah.
So now what about someone then who is listening now who's already in Medicare program? They signed up for a plan, perhaps, just the regular A and B. And now they're thinking, maybe I didn't make the right decision. Maybe I should have considered an alternative.
They can call our 1-800 number. We can do the comparison for them. And like I say, it's really about cost and long term. And I'll give you an example. I've had clients who will come to me and say, "Well, I have the same insurance that Mrs. Jones has. My cost is so much higher than hers." Well, once you start asking questions, you realize that she's taking 5 medicines, Mrs. Jones is taking 2. So it does make a difference in what her cost is going to be. A lot of times people don't even take that into consideration. They just see this $1 amount and I'm going to save this. But when you start sitting down and looking at their drug list, what kind of illnesses they have, then you kind of are able to talk to them about costs and they kind of understand it a little bit better.
Do you ever participate in any way in maybe addressing, for example, a formulary where everything, it looks wonderful for this particular change to go to a particular, not so much a supplemental, I guess it could be a supplemental, but we'll call it an advantage program.
Mm-hmm.
And everything looks good except there's not a particular drug on there that this person needs. Can you intervene?
Oh,
to help?
yeah. We do a lot of help with that. There are a lot of resources available to us and to people who are computer savvy. The St. Louis region is lucky to have an organization called RX Outreach.
I know of them.
RX Outreach.
Right. They're a mail order. They usually handle all of the generic drugs that are available. They even have some discounts on diabetic supplies. I use them quite a bit because a lot of times most people take a lot of generic drugs where you can get a 90-day supply, say for $20, or $180 supply for $35.
Wow.
So, and they're also a nonprofit.
And so what do you have to do to qualify for that? Is it need-based?
You can, I have applications that I can send people. They do have a website, rxoutreach.org. That's their website. And the website will guide you through what you need. Usually all you have to do, their website is set up based on medical condition. So if you have diabetes, they'll have a list of diabetic drugs under there. If you have high blood pressure, they'll have a list of high blood pressure medicines under there. The other thing that I use a lot is called rxassist.org. Okay.
rxassist.org.
And it's just a website where practitioners or patients can go. You click on, you type the drug in. If the drug is listed, then you may be able to qualify for a manufacturer's discount. A lot of times manufacturers have programs people don't even know about. They don't know. And that's because they don't know what questions to ask to say their primary care physician. So what that website does, if that drug is covered, it'll list the manufacturers. There's a form there with the application that has all the requirements there. You click on that, you can print that out. You complete your part of that application. Your physician has to complete his part of the application and attach a prescription with it. Usually the manufacturer programs, the income levels for help are a lot higher, whereas with federal and state programs, the income levels are pretty low.
So the reasons then that the manufacturers might have these discounts may relate less to need economic need than to circumstances relating to the illness itself, right, or the treatment, right, or whatnot.
Yeah, I'll give you an example with myself. I had 2 drugs that cost me $300 plus each a month. And I found out, that both of those drugs were covered by the manufacturer's program. I got both of those drugs free for a year. Okay.
Wow.
And it's income based. They do have some different qualifications if you have, because I do have a Medicare Part B plan. They may have an out-of-pocket a percentage that you have to spend on prescription drugs a year before you can get help or discount. And it's really been helpful for people who have diseases like cancer, especially because those are some very expensive drugs.
Yeah. And
a lot of times the manufacturers pay for those drugs. So it's a lot of resources out there. They can just call us. I'm trying to think of what else we got out there.
Seems like the drug piece is one of those pieces that people overlook, but it really is one of the things that ends up costing you the most money per month.
Yeah.
I mean,
Yeah.
just even a list. Sometimes I've seen people with a whole list of drugs that they take a whole page.
And isn't it also possible when maybe you have a plan and you've been prescribed a particular drug, or maybe you've been receiving a particular drug, but you find out that the plan you're under is no longer going to cover that?
Right.
Aren't there exceptions that are sometimes made? I mean, can't you appeal that decision?
You can ask your physician or provider to send a medically necessary statement to the drug company to see if they would authorize it. Okay, authorize.
Now, is that the insurer or the drug company?
The drug company. And what they'll do is, the insurer, I'm sorry, you're right, the insurer, the drug plan. And what they'll do, they'll review it. If they decide you still may have to pay a higher cost for the drug, it doesn't necessarily mean they're going to add it to their formulary, but your doctor has sent it a statement saying that this drug is absolutely medically necessary for my client. And we have instances where people have drug reactions. So sometimes they cannot take a generic drug. The doctor insists that they take the brand name because the results have been a lot better with the brand name. So they can also, if it's not on their formulary, they can send in, an authorization to see if that drug can be approved by that drug company. But if they can't get it approved, check with the manufacturers. Talk to your physicians. It's always good to have a good relationship with especially your primary care physicians. Feel comfortable with them. Talk to them. Ask them questions. Because a lot of times they have information about programs that people don't even know. And I always say it's about asking questions, knowing what questions to ask a lot of times. Because a lot of times most people don't know what questions to ask. A lot of people are afraid to ask their doctors questions, but I try to encourage people, ask those questions, because the only person that can answer that question for you sometimes is your physician, and they can have a lot of wealth of knowledge to help you with, especially with prescription drugs.
So whenever people are considering, for example, a Plan D, they would want to get a list of the drugs that are covered, I guess called the formulary.
Right.
And then they would want to determine if there are things on there that they could still get covered on potentially, either directly through the insurer, through an assistance plan outside that. And then finally, if they're currently covered, a plan will often allow them an appeal process that might allow them an exception.
Right. But they still would probably pay a higher cost because it's not on, because they have the different tiers. And generic is the cheapest, which is a tier 1 drug. Tier 4 drugs are the most expensive. And it just depends. And the other thing is that tier levels can change every year. I was just talking to a lady as I was coming in. She had called, and the tier level of her drug for next year is higher. So that means she's paying more for that drug. It's very important that people look at their annual beneficiary notices that come from their Advantage plans and their drug plans. That's where they're going to find out whether or not the plan has gone up, the premium has gone up, or whether or not all their drugs are still covered.
Now, how often do those things end up in the trash can?
A lot.
Unopened, that's bulk mail.
Right, because they think, I usually tell people this, if it doesn't say Social Security Administration, if it doesn't say the Department of Health and Human Services, if you're in a drug plan or a health plan, if it doesn't say whatever your drug plan or health plan is, you can probably pitch it. Because people have stacks this time of year. It's just amazing,
so
right? And a lot of times when people come in, like we had an open enrollment event out at Maryland Heights, and this lady came in with a stack of information. Most of it she didn't need. It was just advertisement, just trying to get her to sign up for something different. So sometimes we help them with that process, especially when they bring it with them. We just go through it for them and kind of help out.
So if they get something in the mail and it's saying we can beat your current plan or consider our supplemental program, you'll save money. That's something where it would be a good idea to give you a call, let you guys work through the numbers with them,
Right.
and see if in fact that's true.
And the other thing I want to mention too is you keep mentioning supplemental plans. Supplemental plans are completely different than Advantage plans. They supplement original Medicare. So if Medicare usually pays 80% of your costs once you meet the annual deductible, some people choose to get a supplemental plan to pay the 20% that Medicare does not pay. We call them Medigap supplements, but they're also offered by private insurance companies, which means that would be another monthly premium if you can afford it. But most people who have supplements, they are very happy with them because healthcare, just one bad health outcome, it puts a big hardship on a lot of people because it's so expensive. Even after Medicare will pay their 80%, depending on
Still
what.
huge.
Oh, sure.
Yeah.
And I could give you a great example. A man and his wife went on vacation in one of the American Virgin Islands, so they're considered part of the United States. She fell and broke her back.
Broke her back. Jeez.
So she could not come back via airplane. She had to be airlifted out of there. Okay. They brought her back. She got treated. And why he was calling was he wanted to know if there was any additional help with the bill. Medicare paid 80% of that bill. He still had $25,000 left.
Jeez.
So you see what I'm saying?
That was an expensive vacation.
Absolutely. But if, it was kind of kind of a blessing in a way for him to have that Medicare and that coverage. And he was in territory of the United States.
But a supplemental plan
would have probably picked most of that up.
I see.
Yeah.
Now, normally the supplemental plan is not offered with like Medicare Advantage.
No, you
is
can't.
it?
You can't have a supplement with the Medicare Advantage.
And the whole idea, it conflicts with the fundamental idea, I guess, of
Right.
Medicare Advantage is
Right.
that you're you're going to their people, their stuff, and they save money by buying in large.
Absolutely. Yeah, so it can, you really get some real interesting cases. One of the things we help people with is billing issues. I had a lady calling me. She was in tears. And what had happened was she had this one bill that had not been paid. They were threatening to send it to collections. She was worried about her credit because the bill was going to collections. So I did some investigation, talked to the billing company, called Medicare, come to find out that was the only bill they had not submitted for payment from Medicare. The company had to eat the charges because the statute of limitation had gone out. She was so happy. I told her, this is what we do, just be patient because sometimes it takes a little bit longer than 3 days because you have to ask the right questions, know how to work the system.
Yeah. And those rules. I mean, like,
Know
who would
who
have
to talk
thought
to.
there's this statute of limitations?
Absolutely. And people don't realize there is a statute of limitation, but they had to wipe that off. They had to write that off. Another thing that people can do to save money after they've been in the hospital and maybe they have a large bill, they can call the hospital, ask them if they have a patient assistance program. A lot of people don't do that. That's a good good thing. It can help bring your costs down. They decide how much they will bring your costs down, and then you set up a payment plan with them. Because one thing I've learned, I guess, during the last 6 months is that most older adults hate bills.
Yeah.
They pay.
Well, they're on fixed incomes.
Right. They pay those bills, but when you start talking about sending it to collections, and they have been paying on time forever, it's a big deal to them.
Yeah, and the stress.
Yeah. And she was really under a lot of stress just because of that one bill.
So how often do issues come up where I'll often have clients who think about paying for long-term care costs. And, of course, they're thinking often about qualifying for Medicaid, and that's a whole different discussion.
It sure is.
But what about those situations that kind of fall between the cracks, between those two chairs? Meaning you have the chair where it's medical treatment in a hospital, it's clearly not, ongoing care, and so that's covered by Medicare. And then you have those things that clearly are not treatment, This is not about so much improvement as it is just a chronic condition that needs continual care, and it will not qualify, we'll assume, for regular Medicare. Okay. But then you have, between those two, you have there are circumstances apparently where they can qualify, this borderline, where people can have Medicare pay up to most of the cost for 20 days, and then potentially some part of 100 days total, I think.
Yeah, those are usually called benefit periods. Mm-hmm. And those benefit periods, like the first benefit period is 60 days, so consecutive days. Okay?
Consecutive.
So you can have going to the hospital, say, for 5 days, 1 month, and you still haven't used up your first benefit period. So that means you'd have 55 more days in that period. Once you get to the 61st day, then your coverage changes. You may have co-insurances. They may go up. So it depends on where you are. Even with Advantage plans, they have different costs for those days. Some Advantage plans, the first 10 days are free. Then after that, then your co-insurances start. So it's best to check with the plans to find out what those costs are going to be. Those are kind of like I call those hidden costs that people never talk about.
Yeah.
We have what we call Medicare 101, and it's an outreach program where each month we get topics from the Centers for Medicare and Medicaid, and we go out into the community and discuss with people who are interested in it. When they come to those kinds of presentations, they get a handout, and it's specific to the issue or the topic that we're talking about. They can ask any questions they want. There are different topics for each month. We give the partner sites or anybody that's interested the opportunity to select what they want us to come and talk about. So it's another way of trying to educate and get the information out to people.
Because that's a good program for people to follow up on.
Yeah, they can just contact
without charge.
Yeah, it's free. I mean, all of the stuff we do is free. And we'll get our new 101 outline after the first of the year. Each month, the topic has to be pre-approved by the Centers of Medicare and Medicaid before we can do the presentation. But I like it because it gives me the opportunity to sit down with a group of people to give them something in their hand that they can see.
Yeah.
And read as you
go
go
along. Which people would rather have that.
Mm-hmm.
Most of your clients.
Yeah.
People who are 70 plus or so than the digital options.
Yeah. So it really helps, and it helps to start conversation also, I believe, because a lot of times people hear all these different things, but sometimes with older adults, when you can see it, it makes more sense to you. Mm-hmm. So that's one of the great things that I like about Claim is that we are always trying to educate. We're not trying to change anybody's mind. We're just trying to give them the information that's there. Then they can make their own decisions. A lot of times people will say, well, what would you think? I said, well, I can't tell you what I think because we can't, If they can see it and they can see the dollar amounts, the cost, because that makes a big difference when you start seeing costs. And most people, mature adults, are on fixed incomes.
Yeah.
And a lot of things I hear that I have to make the decision between getting my medicine, eating, paying my rent. So, it's a lot of things that really go into it that you really don't think about, especially the finance part. You just don't really think about that finance part.
So you're there.
Well, and what I think is great is that you look at all of the costs. I think so many people, and especially maybe a lot of insurance companies, will just say, okay, well, your premium is this. Well, that may be true, but if you're having another $300 out of pocket that you could save by a different plan, you're going to be better off with a different plan. Yeah. And that's what I think is great, is that you put all those numbers in and look at it from that perspective.
Yeah, I had a lady call me. She was in an Advantage plan. She was happy with it. A lot of people love Advantage plans because they get the free silver sneaker membership, which is usually through the Y or a gym that accepts it. They get some preventive dental, some preventive vision. Sometimes they will help with hearing. However, she needed physical therapy. But she didn't realize that each time she went to the physical therapist, she had a co-insurance of $40. So the $40 started to add up, and it got a little bit expensive for her because she was also being billed. So it's kind of a catch-22 in a way if you look at it that way, because she didn't really understand that every time you go for a service, you have to pay for it up front. Sometimes you don't, but most times you do.
And that's a characteristic of the Medicare Advantage.
Right. Absolutely.
So still, though, the idea is that overall you should definitely be spending less money if you're doing a Medicare Advantage.
Absolutely.
Because you are living with certain restraints and restrictions that you wouldn't if you were on the Plan A and B.
Yeah. But I think it kind of balances out. When you sit down and you look at the co-insurances, say you might not be paying a monthly premium deductible or even paying for your prescription drugs. If you sit down and start adding up the cost of the co-insurances, they probably do add up to 20%, okay? But even though they may add up to the 20%, you're still getting another bill, which you're paying on the back end, whatever the insurance company's not paying. So you really have to look at the fine. You really have to sit down and look at it, see how much you can afford, if it's the best thing for you. I usually tell people if they are happy with what they have, stick with it.
And you would think that, it's enough that with the Medicare Advantage, you're giving up some of your options that you might have otherwise.
Right.
And so I would think if the numbers are even close, that you would say no. In other words, I would have to feel that I'm being compensated to walk away from, having more discretion in choosing who I want to go to.
Absolutely.
Unless there's a substantial difference, I would think that many people would say no to Medicare Advantage. But I'm assuming often there are advantages,
right,
substantial advantages,
right,
financially.
Because one of the things is that original Medicare does not do anything for dental. Okay, They don't cover eye care except I think with cataracts, because my cousin had some cataract surgery. Medicare did cover some of that for her. So the Advantage plans offer those services, but usually they're preventive services. So they have a limited dollar amount that they're going to pay for that. A lot of times with the dental, it includes maybe 2 cleanings and some x-rays. If you need a root canal or something else, it might not be any money left to go towards that once you get your 2 cleanings and your x-rays, okay? But it's always best to check with the plan when they're offering these extra benefits, because I had clients who called, go to the dentist, get all this dental work done, and then get a bill. And they want to know why the bill was not paid.
They thought that was included.
Excuse me. Absolutely. So that's why I say it's good to ask questions. Do not be afraid to ask questions. Even with where was I? I was at a senior building the other day, and we were just talking, and a lot of times insurance agents at one time were trying to get in these senior buildings to get people, which they're not supposed to do, but it happens.
To make pitches and whatnot.
Right. And so I always tell people when they're approached by salesmen, get their business card. Tell them you're not ready to make a decision yet. You can have maybe if you're not understanding what they're saying, you can call one of us, call one of your relatives, because now you find a lot of children taking care of older adults.
Well, let me ask you this: if somebody has succumbed, they signed on to a plan, maybe they have buyer's remorse or whatnot. In any case, the next time that they can jump from that plan and re-sign would be the next date for open enrollment.
Well, depending on the circumstances, they can get a special enrollment period. Okay, if they did not quite understand what they were signing up for, because I get that a lot.
I would think every event would qualify as that.
No, it doesn't.
meaning that no one understands fully what they're doing.
Yeah. No, it doesn't. We have a list of what a special enrollment involves. Okay, so usually it's on that list. When people sometimes say for the first time they sign up for the wrong thing, they may give them a special enrollment one time to change, okay? But after that, you have to either wait for open enrollment or general enrollment. If you wait for general enrollment, period, for Medicare, then it does not become effective until July. So there is a waiting period in between. The other thing is that you have to be careful not to lose your insurance coverage during that time, because you are penalized if there is a gap in coverage. And a lot of people did not know about the penalty. There are penalties associated with not signing up when you're supposed to.
Yeah, they figure that if they avoid insurance for 4 months, they didn't get sick, that turned out well, but
it doesn't.
Yeah.
I actually just read about that recently, and I went, oh, even if you don't sign up when you first become eligible,
your
that was
premiums
something
are
that
higher.
was new.
Absolutely.
Yeah, and it continues. Like, it doesn't go away, right?
It does seem harsh. I thought about that too.
Well, I don't know. I don't make policy, but I remember when we first started doing all of this in 2006, you had unlimited opportunity to sign up and switch and all of that. And I think somebody just said, hey, wait a minute, and then the penalty was never really kind of discussed a whole lot. Then all of a sudden it became a big issue because people were really not informed that there was a penalty. And that penalty, it's like 1% for each month you do not sign up, on top of whatever the market rate is for the lowest insurance. So if you got a $36 a month plan, if you go 12 months, that's 12% of that on top of that. So
12% above. So at least it's not horrible, but I'll be
But
devil's.
it adds up and it never goes away.
sure it does. It can add up.
I'll be devil's advocate here. Is that, I mean, this is kind of a plan where insurers have to take you more or less if they're participating in Medicare. So people would be incentivized without this to wait and see what happens. And then when a major illness happens, then they sign up. And so I guess then this is the way of disincentivizing that behavior.
Because,
That's it.
because you know what, even people who continue to work, they have to be careful, okay? Because this is just my thought on that, is that, you may continue to work and waive your Part B premium, which is your health care coverage. However, you might work for 10 more years. What's the cost of that Medicare Part B premium? Is probably going to be higher.
Yeah.
Okay. A lot of people don't look at it that way. I kind of look at it, like I say, long term. I had a lady who was covered under her husband's insurance. She was 65. She didn't take Part B. He got a new job, so she was not covered for 3 months. His insurance didn't go into effect until 90 days.
Yeah.
So she got a 3-month penalty.
So
I mean, you
3%.
can try and fight it and get a waiver. Most of the times you won't win.
Yeah, right.
But I'm not trying to discourage you. Just go ahead and try anyway. Call one of our counselors and we can see if we can help you with that. But it just happens. People just assume, I can be without this insurance. You got to have the coverage.
So let me circle back to something. You'd said a few moments ago that among the things that, or I understood you say that among the things that many people are surprised about when they have Medicare Advantage is that they can end up having to pay more when they go to a specialist than perhaps they would have if they had been on A and B. Talk a little bit more about that. So often there is more, you pay more to go to the specialist?
Right. Usually with what I've seen this year is that to go to your primary care physician is $5 on up a visit.
And on the Advantage.
Right. Then they can be for a specialist, it's a different cost. It's usually higher, maybe $30 to $40. Okay. I've seen one that was $50. So a lot of times people don't really know that. Okay. So like I said, that's why I always talk about cost and affordability, because if you don't, if you're going to, say, a heart specialist and you're going there quite a bit, those $50 add up. And then you still get a bill, which you're responsible for. So the insurance company is going to pay their part, but then you're still responsible for whatever's left. So it's kind of like I say, you got this cost up front. You're paying for the office visit, say, up front, and then you get a bill, and then you still have to pay for the cost. That's if you sit down and really most people don't do this.
Do all the math.
Right. If you do all the math, if it's not that much of a difference between original Medicare and Advantage and the savings,
original.
right? Because it gives you freedom. I had a client. I guess I should not say this. I won't.
She changed her mind.
Well, discretion's a better part of valor. I say that as a lawyer often to my clients. When in doubt, it's probably best to not say.
Yeah.
Well, but the point is that's the nature of your job is that
Right.
you see people who are confronted with these crises,
Right.
and some of their own failure to read before they signed up,
Right.
or their own mistakes.
Right.
But sometimes people, though, are just victims of not understanding a complicated system.
Absolutely.
And it is complicated.
It is. It is. And sometimes there are changes, but they're minor changes, but they may affect the whole way you get your health care. And if you don't know about the changes, when you don't find out about them until you go to the doctor, because a lot of people, there's a thing called an advanced beneficiary notice. A lot of people don't know about an advanced beneficiary notice.
I don't know about an advanced beneficiary notice.
A service is not covered by Medicare, the practitioner is supposed to give you an advanced beneficiary notice. Or they're supposed to say to you, this service may not be covered by Medicare.
Now, what if they don't say that?
If they don't and you get billed, you can file an appeal, especially if they didn't tell you, and they will have to, Medicare will not pay for it, and they will not be responsible for it. If they sign off on advanced beneficiary notice, then they are responsible.
You're on notice.
Because you've been informed.
But as a practical matter, we have 2 minutes left, I see. As a practical matter, we all just kind of fill out. I'm a lawyer, and I'll admit right here on this radio show that I don't read all these documents that I'm handed when I go in for medical care.
I understand.
And I can't imagine somebody who doesn't have any legal knowledge whatsoever to be reading all this. I mean, you're in a crowded room. You're wanting to get back and see the physician soon, and you have this sheaf of papers.
Yep.
So you just go through and where it says signature, you sign. But
sometimes you need to read some of them.
yeah,
Especially with the electronic healthcare records and stuff and HIPAA laws.
Yeah, you're
You
right.
need to really take the time to read it, or ask the nurse or somebody to read it to you if you don't want to read it. What does this mean? It's all about asking questions.
well, that would throw their system disarray.
I know.
Most of the nurses will give you a general
Right.
overview.
You'd probably start getting shorter forms.
Probably.
Well, it is, but you are right. I mean, the HIPAA in particularly, where you indicate who can have information released to them. I mean, you really need to read that, and don't always. I would point out to you the tendency is to say no one's to ever get anything ever. Sometimes you do want to authorize access, and think about that before you say no to anybody ever, because there are people who you'll want to have access, such as your physician and others, your general physician.
Right.
So,
I got one more thing to say about access.
1 more minute, go.
A lot of times with Medicare, you have to give pre-authorization to somebody in your family to call on your behalf.
And that's a good idea, really.
Because a lot of times, children taking care of parents think they can call Medicare, and Medicare is going to give them the answer. No, sirree.
No. It's like, parents finding out for the first time their kids go to college that they can't call and get records.
That's exactly what I just thought of.
That's exactly what it's like.
Well, that's a good point. Boy, we could keep talking. I tell you, there's so much information that we've covered here. Julia Allen with Missouri Claim, and that's an acronym for Community Leaders Assisting Insured in Missouri. Julia, I know that our listeners will want you to come back because I'm sure we did not answer every question on Medicare, though I think we probably put a dent in the list.
I think so. Lots of really helpful, good information today.
So thank you for coming, and we look forward to having you back. This is Joe Cordell with my co-host, Susan Arthur. Another episode of Elder Talk. See you next time.
You've been listening to Elder Talk, providing smart strategies for seniors with Attorney-CPA Joe Cordell. Listen again next Saturday for another edition of Elder Talk, sponsored by Cordell Planning Partners, your elder law advisors. For more information, visit eldercarelaw.com. That's eldercarelaw.com. The choice of a lawyer is an important decision and should not be based solely on